Hello everyone. So in this video we are going to talk about illnesses of high altitude, and one of the most common illnesses, mountain sickness, which is most commonly seen in travelers and mountaineers. Now this can be seen in any healthy individual too, but these are the generally one who travel to an altitude of more than 2500 meters. The conditions and the symptoms become more severe in the case the person is more than 3500 meters. Okay, so let's try to understand first the basic physiology behind the condition, and then we will go into the disease proper. So the physiology is that at high altitude the pressure is low and oxygenation at tissue level is low. This condition is known as hypobaric hypoxia. Hypobaric hypoxia leads to acclimatization in person, that is adaptation. Now what is this adaptation? The peripheral chemoreceptors actually of the respiratory system are stimulated. This peripheral chemoreceptor stimulation leads to increased ventilation. Okay, this increased ventilation is also known as hypoxia ventilation response, HVR. Okay, let's see it closely. So peripheral receptor stimulations lead to increased ventilation. Now when there is increased ventilation and you will see an ABG profile, you will see that partial pressure of CO2 is falling and the pH is increasing in the body. Now this condition is what is known as respiratory alkalosis. What respiratory alkalosis does is it stimulates the central chemoreceptor, and central chemoreceptor further inhibit the ventilation. So an increased ventilation due to stimulation by peripheral chemoreceptor leads to respiratory alkalosis, which stimulates central chemoreceptor, which inhibits the ventilation because respiratory alkalosis is occurring. Now after 24 to 48 hours of this condition, acclimatization, we have renal compensation. The kidneys come into play, and there is an increased excretion of bicarbonate. Now this increased excretion of bicarbonate will again lead to decrease in pH. This condition is what is acidosis, and acidosis will again increase the ventilation. Now this is how at high altitude we have increased ventilation to maintain the PO2 and the PCO2. Not only this, we have increased cardiac output and pulmonary blood flow as well as cerebral blood flow. To a small amount, we have also increase in hemoglobin and its affinity. These are the mechanism how at high altitude our body compensates or acclimatize, okay, to maintain the tissue oxygenation. Now we will go into disease proper. The first thing we are going to study is acute mountain sickness, okay, AMS. Now actually in acute mountain sickness we have hypoxemia, that is decreased level of oxygenation at blood. So hypoxemia, as we studied in the physiology, there is increased cerebral blood flow as well as there are conditions leading to increased intracranial pressure. So the symptoms seen in acute mountain sickness are related to these things. Okay, so increased cerebral blood flow and increased intracranial pressure will lead to headache, nausea and vomiting. The patient will also have complaint of loss of appetite. There is difficulty in sleep as well as patient is dizzy. The patient also complains of fatigue. Now these all things start to happen after 6 to 12 hours of an ascent. Okay, after 6 to 12 hours of ascent, these condition starts to appear. These are the thing you must know a bit about the acute mountain sickness. Let's talk about the chronic mountain sickness now. Chronic mountain sickness is also known as Monge's disease. Okay, this occurs in people who have a long exposure to an high altitude, and here the patient have similar symptoms as in acute mountain sickness due to increased ICP and the cerebral blood flow. Plus the patient also suffers from poor concentration and may show signs of polycythemia. You will see cyanosis and clubbing in the patient. Okay, now we will try to understand how do we treat these patients of acute mountain sickness. So whenever the patient has a mild symptoms, we advise the patient rest and analgesics for pain. We give supplemental oxygen and hyperbaric therapy. If the patient do not resolve in 1 to 3 days, okay, then we have to advise the patient to descend from the area. Okay, and we also give carbonic anhydrase inhibitor. Now this will be clear as we have understood the physiology. Carbonic anhydrase inhibitor like acetazolamide, okay, these are known to cause metabolic acidosis, and since we studied metabolic acidosis is going to cause increase in ventilation, okay, this is how by increasing ventilation it will help. Also, if there is if the patient is further ascending up, he is advised to take in prophylaxis of acetazolamide. Plus, the ascent should not be more than 300 meter per minute to avoid, so that body can acclimatize below 300 meter per minute. So this is what we needed to know about a bit about the AMS and CMS. In next video, we are going to talk about some of the complications that are very fatal in the case of mountain sickness. Thanks for watching.